The New York State Office of Addiction Services and Support, or OASAS, provides this podcast as a public service. Thoughts and opinions expressed do not necessarily represent or reflect those of the agency or state. This is Addiction, the Next Step.
Hello once again, it's Jerry Gretzinger here at the State Office of Addiction Services and Supports in our studios with another episode of Addiction, the Next Step. I want to thank you for checking us out today, and we're going to be talking about something really important and useful to a lot of our listeners, I think. You know, millions of Americans do struggle with mental health issues or substance use disorders, and, you know, it takes a lot for people to reach out looking for support and services that are available. But what if the system has roadblocks to those supports and services, right? What do you do to get around those? In 2022, a White House brief found that 29% of adults don't even know where to turn for the mental health care that they're looking for and need. And that is where something called CHAMP comes in to help alleviate some of those roadblocks. Joining us now to talk more about what that is, what those challenges are, and how CHAMP helps is Ryan Gallagher. Ryan, thanks for sitting down with us.
Yeah, thank you for having me.
So, you know, let's start. We talk about, well, actually, let's start with the very beginning. I said CHAMP, right?
Yeah.
So let's break that down for you. What does CHAMP stand for?
Stands for a lot of things. But, you know, the acronym is Community Health Access to Addiction and Mental Health Care Project. Right?
All right.
Have all the letters in there.
That's right. It breaks it, comes all down to CHAMP. And CHAMP really is a champion for people who need help getting through these roadblocks. So let's talk about what those are, right? You know, we want to believe that services and supports are available and that they're easy for everyone to access, but not always the case.
Yeah, well, I mean, the services and supports are there,
Right.
right? But for a lot of people, it makes a lot of sense, comes down to cost, right? And one of the ways we fund our treatment and care is through insurance, right? Our health insurance. It's key to a lot of different things. And so CHAMP is here to make sure that insurance doesn't stand in the way, right? It makes it so people have that affordable access to care through their insurance.
So, I mean, so what does that mean for people? I mean, people know if they've got insurance, they just assume, okay, well, I have insurance. It's going to do what it's supposed to do. It's going to be, equitable coverage for me, for anybody else, or different kinds of care that I'm seeking. Sure. But again, something that's not always the case, right? CHAMP takes a closer look to make sure they're getting what they deserve and that it's equitable.
Sure. Yeah. I mean, I think if you've ever had a healthcare issue, whether, whatever it may be, we all interact with our insurance companies, right? And it can be confusing, right? There's a lot of different rules in places, a lot of different places to turn to. Some providers are covered by your insurance, some are not. There's different types of treatment that are covered, some things are not. And, it can be really overwhelming. You're already, especially people that we're serving, right, going through a substance use disorder or mental health issues, they have a lot on their plate, right? And so adding on top of that, all the insurance issues, it can be really disheartening, right? And so we don't want that to be a roadblock for people. We want to be there for them and help them navigate all that. Yep. So we can, one, very first step, make sure they have insurance. A lot of people don't have insurance, and so we help people, get connected to the resources to find insurance, and then once we are sure that they have that, make sure that they can find providers underneath that insurance that accepts that care. And then once they have a provider, the treatment, right? Treatments aren't always covered. Your provider, your doctor may say, hey, I think this is going to be the right thing for you. I think this is going to be the right step. And they have to get approval from the insurance companies. Sometimes that works, sometimes it doesn't. And so we have to talk to them about that, and we can help them navigate that process.
Now, I just want to point out, too, because we've talked about this many times in the past, that when it comes to insurance coverage and what people are eligible for, we said we have our addiction treatment centers across the state of New York, and I don't want people to confuse it. We do say, and it's true, that someone's acceptance into one of these treatment centers is not based on an ability to pay. If you have an inability to pay, you are still able to get support and services that you're looking for. But in the cases where someone is eligible for insurance coverage to help with the costs, again, that's where CHAMP comes in, right? Because sometimes people don't even know the services that they're eligible for.
Yeah, exactly.
When I say services, I'm talking about like health insurance services, coverage, that kind of thing.
Yeah, no, exactly. And I want to make clear that it's not just, CHAMP is not just for people who have insurance, right? And like you pointed out, there are plenty of services out there that people can turn to for help if they don't have insurance. So
Right.
we talk to people about that. But if they can qualify for insurance, whether that's Medicaid, Medicare, commercial insurance, we're going to try and help them do that. But yeah, insurance itself, if they don't have that, if they don't qualify for that, there's plenty of treatments options out there still.
Yeah, and I mean, and this covers, we're with OASAS, the Office of Addiction Services and Supports, but this is also something that applies to people who are looking for mental health services. Yeah. And we talk about providers, and this even extends to pharmacies. If people have prescription medications that they should be taking and they're having trouble getting coverage, again, CHAMP says we can help with that.
Yeah. No, I think that's one of the unique aspects of CHAMP, right? It is a joint program between OASAS and OMH. And there are, a myriad of players in this ecosystem, right? So we have, substance use disorder providers, we have mental health providers, like you pointed out, the prescription pharmacy providers there. And so, we're navigating all of those with you, right? And that's, I think, part of the key to CHAMP, right? We're kind of there for you all through all of those steps.
Yeah, that's the OASAS mantra, right? Every step of the way.
It's a good mantra, right?
Yeah.
I mean, it is what it is.
And we try to do that. We try to live by those words. Whatever somebody needs at any given time, wherever they're at, we're with them every step of the way, certainly. So what I want to do, if you don't mind, kind of walk us through sort of a real world scenario that somebody might find themselves in where they can sit back and go, you know what? I could use help from CHAMP at this point. And I know one of the things you've mentioned before is parity, right? So if somebody's got coverage, but they're seeing different levels of it, I won't try to explain that. I'll let you talk about it. But what's that real world scenario that someone could see this come into play?
Yeah, definitely. And I think before I get to let me explain parity a little bit.
Okay.
All right. So parity, actually before I started this role, I had never heard someone use that word in real life. But it really is just the opposite of disparity. And I think we're all familiar with disparity, right? Things being unequal.
Yeah.
And so there are a set of laws out there called the behavioral health parity laws, right? That are trying to make substance use disorder and mental health equal, in parity with other types of medical care, right? So medical and surgical, that's kind of what they go to. Now the laws in place, just want to note that they're making things equal. Doesn't necessarily mean that it's going to be good coverage, right? There are plenty of plans that are good and they help people, but there are a few out there that people might not be happy with, right? So it's always something to keep in mind. They're leveling the playing field, right? So what are some real world scenarios? Basic examples would be, if you have an insurance program that is charging you a copay for $100 to go visit like a psychiatrist, right? But at the same time, when you're sick and you go visit your primary care doctor, they're only charging you $45 for a copay. That's unequal, right? That for me would be a red flag and a parity violation, and that shouldn't be happening, right? So we can work with you and your insurance company and say, hey, this shouldn't be happening, right? A different kind of scenario would be you have a high deductible, like a $6,000 deductible, but it covers all benefits. Right? Since it's equal, right, and it's treating everything the same, not a red flag, not a parity violation there. Right? So it's when things are unequal are the kind of the baseline examples. Now, I think thankfully a lot of, CHAMP's entering its 7th year, so been around doing this for a little while. Those kind of baseline examples aren't really happening anymore, but there's still a lot of different things going on, right? Parity involves a lot of different things like prior authorization, medical necessity criteria, first fail policies, or fail first policies. And so they're a little bit more intricate, and that's why it's important that programs like CHAMP exist, because we're experts, we've seen it, we know, hey, this isn't right, and so we can kind of help people through that.
Yeah. So it's like a resource for anybody who's going through this sort of situation, and they run into a coverage issue, like this doesn't feel right. It doesn't pass the smell test, if you will. CHAMP can step in and say, yep, this is okay, or no, it's not, and here's the way through it.
Yeah, exactly.
So also with insurance, I know a lot of times people get worried about denials. They have a request for coverage, and they're afraid of getting the big no.
Yeah.
Something else that CHAMP can advise on.
Yeah, definitely. And for me, one of the most useful parts of it, right? It turns out about 60% of adults don't even know that they have the right to file an appeal, right, when they have a denial, right? So when you get a denial from your insurance company, it's not just, oh, well, right, and that's that, right? Many times, and quite often, you have the right to appeal that decision with the insurance company, and we can help with that. And I think this is where that OASAS model, every step of the way, comes into play, right? CHAMP is not just a program that'll tell you, oh, file an appeal, and then leave you to do it, right? We will sit down with you, make sure you got the right paperwork from your insurer, right? Write the appeal with you, and then file that appeal, right? And then check up with you and say, hey, did you hear back? Well, how's it going? Did you win? No. What's the next step? Let's talk about that.
Right, and then you continue to work with them through that.
Of course, yeah.
And I think that's probably a huge benefit for people to know is available to them, because you get those things where you've been denied, and very often, like you said, people may not know they can file an appeal, and if they do know they can file an appeal, where do you start? How do you write this? I mean, you hear that, it's like, well, I'm not a lawyer, I don't have all that information to figure out how I can advocate for myself. CHAMP will help you do that.
Yeah, definitely. And not only that, in addition to appeals, there's also complaints, all right, which are a little different, right? And the complaints go to the regulatory body of the governing body, right? And different types of plans have different governing regulation entities. But to me, that's also important, because the appeal will help change your denial, all right? Hopefully, right? The complaint kind of looks at it in a bigger picture, right? Because quite often what happens, if you win an appeal, the insurance companies will say, oh, well, very sorry, that shouldn't have happened. That was a one-time thing, and won't happen again. But filing a complaint with the government, right, allows them to see, hey, this is happening a lot, right? And it's not just one person, right? And so, if that's the case, then, they can start taking bigger steps, right, to make sure it's not happening to other people too. Yeah.
So, let me ask you this question before we kind of get towards wrapping things up here. Do you feel enough people are taking advantage of CHAMP? Because, again, it sounds like it's a terrific resource, and it's the sort of thing where I feel you can't spread the word of it far enough, right? It's like, no, this is here. Take advantage of it. Yeah. There isn't a cost for this service. It's just here to help.
Yeah, no, I mean, it is free, right? We don't have any kind of requirements. There's no income requirements. You don't have to have a certain type of insurance, right? It's so no cost, no insurance type. It's for everyone across the state. We have our statewide helpline that people can call into. We have 9 different local CBOs people can go into in person if they feel more comfortable speaking in person with somebody.
Okay, you said CBO. Tell people what it stands for.
So sorry. Yeah, no. It's a community-based organization.
Yep. Okay.
Yeah. So people can go and talk in person with that. And, we support all languages, of course. So, do I think enough people are using it? I'm happy with everyone who calls, but I want everyone who has going through this to know about us and to reach out to us, right? Yeah. So whether it's yourself or a loved one or a friend, right? I want people to know that this resource exists.
Right. It's easy as a phone call away. So why don't we make it even easier? Tell them the number, right? Yes. What can they do?
You can call 1-888-614-5400.
Okay. Give it to them one more time, because somebody's whipping out a pencil.
Of course, yeah. 1-888-614-5400.
Great.
Right, and we have information on the OASAS website as well, and so people hopefully can find that.
That's what we hope for. That's why we're here. Thanks for sitting down and sharing this important information, Ryan. We appreciate it.
Yeah, I thank you for having me. I really appreciate the opportunity to tell more people about CHAMP.
That's what it's all about. And he mentioned the OASAS website. It's oasas.ny.gov. That's oasas.ny.gov. Our Hope line, obviously, 877-8-HOPE-NY. That's all out there. It's resources for you, support, services, everything we can do to help out and be there every step of the way. I'm Jerry Gretzinger. Thanks for joining us for this edition of Addiction the Next Step. We will talk to you next time.